Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. One of the public health risks that we commonly face during the summer months is extreme heat. Extreme heat can sneak up on anyone and can sometimes cause serious illness. Today, we're going to look at how extreme heat impacts the body, our emergency medical system, and the wider community. First, we're joined by Dr. Tyler Vaughn, an emergency physician who cares for patients at UCHealth emergency departments in northern Colorado and oversees UCHealth EMS, which serves much of Weld County and northern Larimer County. Dr. Vaughn, thank you for joining us today.
Thank you guys for having me. It's a pleasure to be here.
As an emergency healthcare provider, when do you expect to see heat-related illness? Are there certain weather patterns or circumstances that you see in the forecast and expect to see heat-related illness show up?
Yeah, so when we, have weeks like we have over the recent past where we're having recurrent high temperatures for prolonged periods of time, that's when we start to see more and more heat-related illness. We also notice a considerable increase when long, hot days tend to intersect with, recreation in our community. We also notice, not that we tend to see considerable amounts of humidity in our region, but when we do get our unusual humid and hot days, definitely notice that correlates with the increase.
How does extreme heat impact the body?
So it kind of depends. So heat-related illness can be kind of a spectrum. It starts as simple as feeling warm, feeling a bit tired, and all the way through very severe heat illness, heat stroke, where we start to see confusion, mental status changes, and, losing the metabolic processes of the body start to kind of break down, and we lose our ability to regulate on the real kind of extreme side of heat illness.
And you started to talk about it a little bit, but can you explain the differences between heat stroke and heat exhaustion?
Yeah, like kind of mentioned before, it's a little bit of a spectrum, but the heat exhaustion is where our body gets too warm and we still have the ability to attempt to regulate that. So that's where we start to see things like headaches and fatigue and nausea. The body temperature starts to rise, but it's really our body is starting to struggle to keep up with that heat at that point. Where we start to see the transition into what we would consider heat stroke is when that high temperature also goes along with effects on the brain or effects on other organs. Primarily the brain is where we see it manifest first, and confusion is one of those big red flags that we see that says, hey, this is a really serious illness. And it's also really tough for the person experiencing heat illness or heat stroke, because once you start getting to that stage of confusion, you don't notice that something bad is going on, and it can sneak up on you, and you can get sicker without really noticing that you're getting sicker.
So when someone shows up at the ER and you think they're experiencing heat illness or heat exhaustion, how do you diagnose it?
So it's, as with most things in medicine, a good thorough history and physical exam is the cornerstone of everything that we do in medical care. Finding out what the person has been doing, what they've been exposed to, if they've been out in the heat. We also look for risk factors. Are they on medications that can predispose you to heat illness? So those all kind of factor into that history gathering. When we're examining someone, we're always looking for a good set of vital signs, meaning blood pressure, heart rate, temperature, and we would expect to see, higher heart rates or higher temperatures as we're kind of working that up and building that picture of either heat exhaustion, heat stroke, dehydration, things like that.
How do you differentiate between, I guess, heat stroke, heat exhaustion, and, maybe just being, worn out because, yes, you've been playing touch football out in the sun, and I'm trying to think of where you would draw that line where you would say, oh, actually, you need to go to the ER. This is a concern now.
It is a bit of a spectrum. The trigger points often to come to the ERs, first, we're happy to see people in the ER. And, we know that people don't want to be there. Everybody has better things to do than hang out with us in the emergency department. But we want to be there for the people that need us. And so it's definitely a case of, we're happy to see you if you're worried, if you're starting to feel like you're going to pass out, if you're nauseous and you're not able to tolerate fluids, and you can't get hydration at. That's where we're going to start to say, hey, maybe we need to start an IV and try some medications. And then obviously on the much more extreme end, it's going to be someone who's losing consciousness, is confused, is so weak that they're unable to stand. Those are going to be cases where we're going to have a much higher level of concern and probably will be a little bit more aggressive with the interventions that we provide.
That's a great segue just to my next question here. I was going to ask, what does treatment look like for heat-related illness? It sounds like fluids is a big part of it. So it sounds like you might be giving them an IV. What other kind of interventions would you guys typically do? And kind of also looking at like some of the more extreme cases.
In the last couple of months, we have actually been working with our EMS partners to develop a update to our pre-hospital protocol. So that's how our ambulances take care of people in the environment before they are able to come to the hospital. And we did a literature review on what is the best practice for a heat stroke and heat-related illness. And one of the most important things that we do on the particularly sick side of things when people are critically ill is immersion therapy. That is by far the gold standard for heat stroke type patients. And what that involves is essentially an ice bath. It's putting that person kind of up to their chest in ice water that is ideally in the 50-degree range, which is frighteningly cold for at least my perspective of wanting to go in any sort of body of water. But it's what those patients need to rapidly cool them as quickly as possible. Now, not everybody has an ice bath sitting around, and most of our ambulances don't have ice baths handy. Our fire departments, they also have, large trucks filled with water that can potentially assist us with that. And sometimes it's just not practical to do that. But that's generally what we're going to be aiming to do once you get to the hospital is we're going to be putting you in an ice bath and trying to get your body temperature down as quickly as possible.
Wow. I've got to ask, how long does somebody have to stay in an ice bath? That seems extremely cold.
It really depends. But, I've had patients where we've had to keep them in an ice bath for up to an hour in the past because their body was so dysregulated that it just took a lot of effort to get them back to where they needed to be. And we will take them out before they get back down to a normal temperature because we also don't want to overshoot into hypothermia. But it's usually pretty rapid, usually within like 5 to 10 minutes. You put them in the ice bath, we start seeing their temperature come down, and we're able to remove them from that ice bath, and they start to improve pretty rapidly. And then it goes along with some other just kind of generally good methods of, looking at labs, getting IV fluids, making sure blood pressure and heart rate and all that are doing what we want to do to make sure that person is able to get better. Generally, for those extreme cases, we're going to be watching them in the hospital, typically in the intensive care unit for a bit of time. Again, on the real extreme side of heat stroke, you can start having problems with your body's clotting factors and other various enzyme functions start to not work very well. Our body is very good at adapting, but on the extreme ends, when things start to break down, they can have this kind of strange cascade effect. And that's where we want to have somebody in the hospital for a bit of time and just make sure that things have stabilized before we kind of get them back to home and doing all their normal stuff.
Are there certain groups that are more prone to heat-related illness or at greater risk for some of these more severe symptoms?
One of the highest risk categories is going to be older adults. One of the cool things I get to do is I sometimes get to respond out with our crews. We had this wonderful patient that I took care of. It's been a couple of years now. It was a group of older women who would hike every single day, and they loved being out in the mountains. And I get that because that's what I want to spend my time doing too. And they were out on their normal morning hike, And one of the group started feeling kind of weak, started feeling lightheaded. And thankfully, their friends said, "Hey, this is not good. We're going to have to get you off the mountain." And they called for help. And we got to be a part of that rescue of getting that person off the mountain, getting them into a cooler environment, giving some fluids while we were on the way down. And it was just kind of this highlight of, these are people that are doing this every single day. That she was out there every single day hiking. This was not a new thing for her. It was kind of part of the normal daily routine. And, it just kind of snuck up on her. And unfortunately, because of her age, she was a little higher risk than the average population for having more complications. And, she did great. She recovered well with just some simple IV fluids, but it required a little bit of effort to make sure that we were able to safely get her down off the mountain and she didn't fall off a cliff or, get stuck up there for a prolonged period of time. Again, we're a very active community and we can see this kind of sneak up on us when we're doing our normal activities. And I have to remind myself when I'm going out on my mountain bike to, be mindful of the temperature outside. And then obviously, the people who are working outside are also at risk, folks that are, exercising and recreating, and it can just be a little bit insidious with some of the temps that we're exposed to.
What are the long-term impacts of exposure to extreme heat?
The overwhelming majority of folks will do great with this. The vast majority will. Heart failure, pulmonary hypertension, and some autoimmune conditions can sometimes get worse if you're kind of re-exposing to heat illness. Now, if you're outside and you're staying hydrated and you kind of moderate the activity, it's not necessarily going to make it worse. And probably the activity is really good for most chronic conditions. But at the same time, it's just good to be insightful and watch for signs of illness before they creep up on you.
If you start to notice some of those symptoms that you mentioned, either in yourself or notice them in someone you're with, how should you respond?
Fortunately, mitigating, heat exhaustion, heat stroke can be something that you can respond to without help in a lot of cases. Drinking lots of water. Generally, we would recommend water for the vast majority of cases. But if you're outside and recreating for a prolonged period of time, making sure you're getting some electrolytes in from time to time is definitely a reasonable consideration. And then if you start noticing that you're starting to feel extra fatigued, maybe starting to get nausea, getting out of the heat is definitely something that can be helpful. And in the case of recreation, just getting into some shade. And if you've got a little extra water kind of misting your body, evaporative cooling can be enormously helpful with our typically dry climate. Usually some water on the head, some water on the armpits, and just letting that evaporate can be really, really helpful. If you've got a mister or spray bottle, those are particularly helpful. Reducing the exposure to heat, getting into a cooler, more air-conditioned environment is also very helpful as well. And then there's, lots of public areas that if you're in a spot where, you don't have air conditioning in your house or something like that, that you can, visit a shop or something like that where they've got air conditioning and let your body cool down.
In addition to those sort of responsive measures, are there steps when planning your summer activities that you can take to help prevent heat-related illness?
Honestly, avoiding kind of the peaks of the day is definitely a good practice, I would say, in general. Get out. If you're going to do heavy activity, then it's probably ideal to get started really, really early and be able to be done before the peak of the day.
How do extreme heat events impact our local hospitals and emergency medical systems?
As heat and outdoor recreation and events increase, we definitely start seeing an increase in visits to our system. There was a festival in the fairly recent past that I saw at least 10 911 responses to for heat-related illnesses. Those are just the ones that made it to the point of needing to transport, not the local, a lot of times we'll have event support out there that doesn't necessarily result in somebody needing to go to the hospital and us just kind of supporting them on the scene. Our teams are, again, they're always happy to help, but prevention is, this stuff that you all do with public health and prevention is huge in terms of being able to allow people to just kind of do what they want to do and do it safely.
Have you seen the impact of extreme heat events on our local emergency medical system change over time?
We cover a geographic area in northern Larimer County and Red Feather Lakes, Crystal Lakes, Livermore. As time goes on and we see that there's, the summers are getting hotter, a lot of those communities don't have air conditioning. And we're watching that to ensure that, we can support those communities as we can and help prevent those folks from getting sick. And just kind of understanding that, especially again in homes without air conditioning that aren't typically expected to have extremes of temperature, that we're watching out for the folks in that community.
Well, Dr. Vaughn, was there anything that we didn't cover that you wanted to share?
One of the things that I didn't talk probably as much about from like the broader public health perspective is just that a non-exertional heat stroke is definitely the one where we see the most extreme illness. Mortalities can approach 50% for some of the patients with that. And that's almost always going to be our elderly patients in a home without air conditioning. Those are harder cases to, one, to identify, and two, to prevent. If you've got a neighbor that's, older and maybe doesn't have air conditioning, making sure that you're checking in on them. Unfortunately, folks with substance abuse disorders, probably the most common population we see at the ER in terms of heat-related illness, that we're able to definitively say that, they just weren't able to get that help. And so it's something where just keeping an eye on community members is a helpful thing, and getting them to the resources to help with those, substance use disorders. We're fortunate to live in a community where there's a lot of potential options for that. It's easier to say than it is to actually get through the process, but it's something where, especially on the ER side of things, it's a no judgment zone. We want to make sure that we're doing the right medical thing for people, and we want to make sure that they're getting to the treatment that they need.
Awesome. Dr. Vaughn, thank you so much for joining us.
Yeah, thank you guys for having me.
Today, Jared Olson, a population epidemiologist here at the health department, joins us to talk about how extreme heat impacts both people and systems throughout Larimer County. Jared, thank you so much for joining us.
Thank you for having me, Joanna.
Can you just explain your role at the health department?
Yeah, absolutely. A lot of what we do in population epidemiology is focus on the health of the whole community instead of one individual outcome.
Can you define population epidemiology for us?
Sure. So population epidemiology is a field, and it focuses on the population level rather than individuals. And it studies the distribution or the burden of health effects, health outcomes across that population. So we're looking at those trends and patterns that might indicate an excess of disease or an excess of harm that we can have some sort of positive impact on.
How does that differ from other epidemiologists that work here at the health department?
Sure. So some epidemiologists may focus on a specific subset. So, for example, our communicable disease epidemiologists focus on the burden of communicable diseases, whether that be measles or West Nile virus or other burdens our community faces. And they specifically spend a lot more of their time sort of tracking disease across our community, whereas population epidemiology focuses a little bit more upstream, looking at opportunities to prevent injury, illness, and disease, and particularly focused on disparities in our community, where some communities or groups may experience higher rates of disease for reasons outside of their control. So we're interested in the whole population. So we're focused across where different communities live, what some of the features or some of the determinants are that impact their health. So what is their housing like? What are their incomes like? What sort of educational opportunities do they have? And how might that impact their ability to access healthcare or access kind of those healthy habits of daily living?
How do we define extreme heat?
So there's different ways you can define extreme heat. I think one of the most useful tools is the CDC heat risk tool, which takes into account not just how hot is it, but what are the contextual factors of that? So what's the humidity likely to be? What's the overnight cooling effect? And what is the time of year? So if we're significantly above our average, or if we're early in the season and experiencing a higher than normal heat event, that would trigger the heat risk tool, say on a 90-degree day in April, when it might not necessarily trigger that same heat risk indicator later in the season where 90-degree days were more typical.
And how common are extreme heat events here in Larimer County?
Extreme heat events are becoming more common. So I wouldn't say they're terribly common, at this moment, but they are becoming more common, and we are generally seeing an increase in maximum heat temperatures during the summer. We're also seeing an increase in temperatures in our shoulder seasons, especially the fall. But 6 of the 8 hottest years we've experienced in Larimer County have come in the last 15 years.
How is extreme heat different here in Larimer County as compared to other parts of the country?
Absolutely. So we do have a couple of mitigating factors that have worked to our advantage thus far when it comes to extreme heat. So firstly, we don't have the regular high levels of humidity that other places of the country do. So if you look at the Southeast, they have much higher humidity along with very high temperatures. And that's something we haven't encountered yet and may not in Larimer County because of our more kind of semi-arid climate. At the same time, we've also had the advantage of lower overnight temperatures, meaning even if we have a 90-degree day, we typically will cool off into the 50s or 60s at night, which allows us to kind of reset that temperature and then allow for cooler mornings the next day.
So you've mentioned that the extreme heat events seemed like they're becoming more common. Is that also translating to increases in heat illness? Is that what we're also seeing?
We are seeing some of that. So we've been able to track our emergency department visits related to heat illness since 2022. In the first couple of years, we saw 2022, 2023, we had about 60 visits. Now we had 80 as of 2025, and we've had 46 visits already this year. And that's in anticipation of a high heat event next week.
Who is most impacted then by these extreme heat events? Where are these numbers coming for heat illness?
Yeah, so it really does span kind of the gamut of experiences. But last year, we saw for the first time the majority of our emergency department visits were among our older adults, 65 and older. That was our largest cohort that was visiting the emergency room. So I think that's part of this accelerating trend is specific vulnerability for our older adult population. However, we have other groups that are experiencing particular risks, such as outdoor workers. Maybe that's construction, maybe that's landscaping, but those folks particularly might be at an elevated risk. And we do see that for our kind of 25 to 44-year-old males. Children are also at risk. They may have a reduced ability to mitigate that high heat event and deal with it. They may also be more at risk in interior environments like a home that has trouble cooling down overnight.
Are there specific parts of Larimer County that are more impacted by these heat events?
Yes. So when we look at Larimer County, about 92% of our households are estimated to have air conditioning, right? So we have a pretty high level of ability to control that internal environment. And in addition, you have locations within the county, those at higher elevation, which generally see more moderate temperatures. So they might still see a high heat event relative to what they're used to, but it might not be quite as severe as it is lower down in the Front Range and the Plains, kind of Fort Collins, Loveland, and further east. So those areas are likely to have a little bit easier time with some of these high heat events. So one of the concerns I have is the particular overlap of wildfire and smoke exposure combined with high heat. Yeah, one of our opportunities in Larimer County, because our overnight cooling has been so stable, has been to open our windows and air out the heat that accumulates in our homes during the day. So wildfire smoke complicates that picture, if not really even eliminating it in some cases. So there have been, historically several fires close by us that have impacted our direct air quality. But we've also seen over the summer increased PM 2.5, that particulate matter in the air, to unhealthy levels because of fires in Wyoming or California or even Canada. We also have wildfires across the state in Colorado, and then sometimes those plumes may impact us as well. So if folks aren't able to open their windows to cool off their homes in the evening because the air quality is poor, this can be a significant barrier to kind of managing the heat, especially if you don't have available air conditioning.
Are there other kind of impacts that you might see that are more on the behavioral or mental health side where, hey, it's hot, people might have a shorter fuse?
I mean, I certainly have a shorter fuse. Yeah, it's not so I can speak for myself with that, but you're absolutely right. The literature is pretty clear on this, that you have an increase in behavioral stress, mental health challenges, even something like road rage, right? So traffic safety might be impacted by that. That's not something we can necessarily correlate to every hot day. But we know that that is something that's kind of like an underlying thing bubbling underneath the surface. At the same time, we do know from our emergency department data that we see many more visits on 95-degree plus days than we see on those days under 90 in the summer season. So about 5 times as many people visit the ED for a heat-related illness on those 95 plus degree days compared to those days under 90 degrees.
Interesting.
In addition to heat illness, how else does extreme heat impact Larimer County?
So heat illness shows up not just in the individual, but it also puts an additional strain on our healthcare system. So folks in the emergency department on these high heat days, we're going to see an increase in overall visits, not just for heat-related illness, but as you mentioned, for maybe some behavioral health issues or increased accidents because people have trouble focusing during higher heat. So just there is a healthcare impact. It can also strain already vulnerable populations with heart conditions, asthma, COPD, things like that. So that's one possibility. We may also impact our utilities and our electrical grid. That's a significant risk. And of course, if you're 95 or 100 degrees, having your electrical grid out and having your population not be able to cool their homes as they normally would can be a significant risk.
As these extreme heat events have become more common in Larimer County, what has the community traditionally done to help people?
Our health department takes the initiative to make sure we're sharing that information with the broader public so that they can do everything they can to mitigate their risk and reduce the risk of injury. We also connect with the Office on Aging that works across the whole county to share out cooling resources, especially with our seniors and our adults with disabilities who may be more vulnerable. We also reconnect with hospitals, nursing homes, schools, childcare centers, other locations where there are vulnerable groups, make sure they have everything they need as far as guidance, resources, and make sure they have backup plans if something does go wrong too. That can include evacuation of a site that's no longer safe in a high heat event if they lose power, for example. We also pay attention to our emergency department data. We're lucky that our syndromic surveillance emergency department data is near real time. So we're able to see what's changing kind of day by day and whether we have particular impacts to that population. And of course, there's other resources and partners who are actively working within the community. And as we continue to have these high heat days, there's probably more planning that we can do to mitigate these harms in the future.
What role do cooling centers play here in Larimer County?
Yeah, so cooling centers are definitely part of the response, and they have been a key component, especially for outreach to individuals experiencing homelessness, right? So that's been an opportunity for folks to get out of the heat, get a little reprieve, especially in an indoor space. And our municipalities and other partners have been great, including the public library system, have been great about supporting that work for a long time. The other component of this is that even during a high heat event, most individuals prefer to stay at home. They want to stay safe and they want to stay at home. So oftentimes cooling centers might be underutilized relative to what you would expect in a high heat event, especially in Larimer County, where, as we mentioned, air conditioning is relatively prevalent and there are options for other individuals that they might employ, like going to a grocery store or going to a movie theater or something like that. So there are some challenges with cooling centers, and that may be part of the solution moving forward, but we're probably going to have to be innovative and look for other complementary tools.
What steps have other communities taken to address extreme heat?
Yeah, so other communities have been working at this for a long time, potentially longer than Larimer County because of, as we mentioned, the humidity issues, as well as more extreme heat in some of our southwestern communities. I'll use the example of like Philadelphia, which had a spate of deaths in the 90s and has responded with a couple of approaches. One of the major things they did is they went and activated their community resources. So instead of trying to be everywhere, trying to inform individuals about the risks and then take steps to support those most vulnerable, they relied on community activists and community participants like block captains and faith leaders to kind of get the word out and also to check on their neighbors, right? So if somebody is homebound or has limited mobility, they may not be able to reach out and get the help they need. But if there's a neighbor who can support them in that, then they may be able to move to a cooling center or address any issues they're having in their home that might reduce their ability to cool it on their own. At the same time, those are kind of emergency responses, and cities have also been planning 5, 10, 15 years in the future at the same time. So there's a lot of strategies for reducing the overall heat island effect that we get in our urban locations.
What do those look like?
A lot of those are about increasing shade and reducing our heat sinks. So things like pavement absorb a lot of heat in the sunshine, and then they radiate it off throughout the day, especially at night when there should be overall cooling. So if you can do reflective pavement, or if you can reduce the amount of pavement, right? Sometimes you don't need all those large parking lots in your community. If you can cover some of your pavement with forestry and an urban canopy, that can help reduce the amount of absorption. And interestingly, in Larimer County, some of our biggest cooling effects are from irrigated grass.
Oh.
So there was a heat study a few years ago, and it found that those locations where you maybe didn't have as many trees, but you had grass fields that were irrigated, actually were having a cooling effect on those immediate neighborhoods. So I do think integrating shade wherever possible. There are some unique opportunities that would require water, but might be lower water opportunities since we do have a low humidity environment. Adding water into our cooling mix may be a viable option for us, especially if you're in focused locations. You'll see folks already congregate around the pooter and around other bodies of water because it is cooler in those locations in those super hot days. Green roofs are helpful. Anything you can do in order to kind of move your urban environment to something that looks a little bit more like your forest is probably going to help you out. We also have quite a bit of wind in Larimer County. And sometimes that can help us out as we dispel some of the heat of the day. I'm not quite clear on how we can kind of maximize that one, though.
Are there steps that residents of Larimer County can take to help protect each other during extreme heat events?
Yeah, absolutely. On the individual level, I would just say if we tip past 90 degrees, especially 90 degrees, reconsider what your activity level is for the day and whether you can move inside, move to a cooler part of the day, just do something a little bit different because it is a significant change. At least what we see on the population level with folks coming into the emergency department right around 90 degrees, it jumps up. So if you're potentially putting yourself more at risk through daily activities, anything you can do to mitigate that, whether it's shade, time of day, or revising the activity entirely would be super helpful. And that's something to share with your neighbors and particularly your neighbors that may be more vulnerable. So if you have folks on your block or in your neighborhood who are more homebound or limited mobility, who are older adults, or who you might know have some sort of chronic condition that increases their vulnerability, have a conversation with them about how they're handling high heat days.
So, Jared, how are you staying cool during these extreme heat events?
I have multiple kids, and swimming, they love swimming. So we are trying to swim. We are trying, we are running our AC. I don't love running the AC. I'm one of those dads. But we're doing it now. Windows open at night if we can.
Awesome. Jared, thank you so much for joining us.
Thank you.
In the summer months, we experience an increase in a number of public health risks, from extreme heat to air quality to animal-borne diseases. When these risks are present, public health agencies often send out some sort of notification to let the public know, whether that be a press release or social media post or an alert through text or email. While these notifications are important, they can also sometimes feel overwhelming. Here to help us understand these summer alerts and what they mean for our day-to-day activities is Dr. Paul Mayer, Medical Officer here at the Health Department. Dr. Mayer, thank you so much for joining us.
As always, I'm glad to join.
What public health risks do we encounter more of in the summer here in Larimer County?
When I think of public health risks by season, typically I think it's helpful to break them down into categories. So for each season, including the summer, you can think of things as behavioral, environmental, or infectious disease categories. So in the summer season, the two main risks that come to mind are going to be automobile safety and water safety. During the summer season, we tend to travel more, take more family vacations. So people are out in their cars more, they're traveling longer distances. So I think that becomes very important. Things like wearing your seatbelt, making sure your car seats fit correctly for your children. And one unique hazard for autos in the summer is it's very important to understand how quickly an auto can get dangerously hot. Every year in the United States, sadly, about 37 children on average die by being left in a car unattended. And typically, the most common cause of that is when parents simply forget their child's in the car. They get distracted and busy, and they'll go into a store or a place and forget the child's in the car. Other things like basic water safety guidelines, carry a life jacket if you're doing any kind of river rafting or boating. and make sure that you're aware of everybody in your party who can or can't swim. The next category would be environmental risks. So for summer, of course, heat would be the main environmental risk. And heat is the number one weather-related cause of death in the United States as opposed to cold or rain or other exposures. And so very important for people, particularly people who are vulnerable to heat injury, like heat stroke, heat exhaustion, to be aware of that risk. Another environmental risk would be smoke from wildfires. We're currently experiencing quite a bit of that here in Larimer County with the current wildfire smoke that's blown in from some regional fires. The last category would be infectious disease. In Larimer County, we are uniquely blessed and cursed. Cursed with West Nile more than many other counties here in Colorado. But I try to throw in some good news with all of my messaging, and so I'll let people know that there is essentially no Lyme disease native to Larimer County or in general to the state of Colorado. Also, people may be hearing more and more about a thing called alpha-gal or a meat allergy syndrome. And the ticks that carry that, or whose bite tends to predispose to that, are really not found in Larimer County. So we essentially don't see that as a problem in Larimer County from local ticks. Certainly travelers can get it in other areas. Other infectious disease risks would be things like rabies. And that's just based on the fact that rabies is most commonly associated with bats, and it is in the summer months that many species of bats come back and are active through the summer months. Other things that increase during the summer months would be food poisoning, just again because food tends to get warmer if it's left out quicker and can spoil faster. So we see more food poisonings. And then we have some rare things like tularemia and plague, which are usually more of a localized problem. Another thing people don't think of necessarily, but we do see an increase in STIs in the summers. There's an increase in festivals.
And World Cup celebrations this year. How do public health agencies decide when to send out notifications about all of these risks?
So those decisions can be difficult. I think there are two ways that I think of it is if there's a significant risk of anything above the baseline risk, then we'll tend to want to send out a notification, warnings about heat injury, because we know that every year there are a large number of emergency room visits for heat injury.
Sometimes we send out notifications to the community at large. For example, if we detect tularemia in Larimer County, we let the public know. And then other times we work one-on-one with an individual. I'm thinking of when we have a positive TB case, we work with that individual. How do we decide when we let the larger community know of a risk versus working sort of with the single impacted individual?
I think the examples you gave are excellent. What we tailor that messaging to essentially who is at risk. So if we have something like wildfire smoke, we're all at risk. Something like tuberculosis, luckily, is not so contagious as other diseases. So in a case like that, we'll focus on the close contacts.
What is the desired outcome when we send out a notification? What are we hoping happens?
What we're trying to do is induce a behavioral change in those people who are not already aware. So people who are aware, of course, and they've either decided or not decided to make a behavioral change, but probably our notifications is not going to change that because they're aware of the risk. It's for the people who may not be aware of the risk and realize that sometimes very simple behavioral changes can make a big difference.
How do we balance the need to make the public aware of these risks with the potential for alert fatigue, especially during the summer?
That is one of our biggest challenges because, as you know, the alarm that always goes off is no longer an effective alarm. So we do really try to balance that out and not send alerts for things that are not significantly changed from what people would expect.
Do you have any interesting stories that you could share with our listeners about maybe something unique that you encountered as a result of maybe the summer or the heat?
I think the most relevant thing I can relate is that as I was doing research on heat injury, I found it fascinating that somewhere around 90% of all significant heat injury happens in the first day on the job or the first day of practice or tryouts for sports. Just points out the critical importance of gradually increasing your exercise, gradually getting used to the heat. It takes about 2 weeks to get used to heat. And unfortunately, you can't sit in air conditioning and get used to heat. You do have to start exercising gradually in the heat, and your body will make basic physiologic changes to that heat. But it takes about 2 weeks to get used to it.
So, Dr. Mayer, how should people interpret these public health alerts and notifications? Like you just mentioned, sometimes these can be a little overwhelming at times. So when you get one of these alerts, what is it that you should do?
The answer to that depends completely on who you are and your underlying health status. If you're generally very healthy, and don't have any major medical troubles. Many of the alerts we send out are good to know, but you may not need to change your behavior a lot. If you're somebody who lives with a chronic disease, such as heart disease or lung disease, then those alerts become much more important. And in truth, many of our alerts are tailored to people who have chronic illness because for them, an unusually hot day can put them at significant danger. But even young, healthy people can have one condition such as asthma. For those people, it might be really very important to be aware that the air quality has taken a bad hit from wildfire smoke, and they in particular will need to be very careful with outdoor exercise.
So, like Joanna mentioned just a few minutes ago, how can people balance then the benefits that they get from outdoor activities, the mental health benefits, the physical health benefits with the risks that might come with that?
I think it's really important that we in public health remember that we don't want to make people afraid of everything, and that things like outdoor exercise are very important, not just for physical health, but our mental health as well. And so we don't want to discourage people from doing outdoor exercise, but we want them to do it in a way that's going to minimize their risk. For instance, if you're vulnerable to heat injury, outdoor exercise in the morning is fantastic. Luckily, in Colorado, our nights usually do cool off pretty well, so you can exercise even vigorously in the early morning hours. Other things like wildfire smoke, you can check websites like airnow.gov, and they'll let you know what the current air situation is. And that one is not as predictable as the heat, in that sometimes early morning hours are not necessarily better for air quality. But if you'll watch that site, you can usually find some time during the day when it's okay to exercise.
If people are concerned about a specific summer health risk, do you have suggestions for questions they can bring to their primary care provider?
Yes, I worked as a primary care provider for many years, and I think the most important thing for people to do, to be honest, is to write down their questions. What I would find is people would come in and they knew they had 4 questions, but they could only remember 2 of them. So when you have questions for your primary care doctor, write them down. It's very helpful to keep a list. And also it's nice because you can write the responses down as well. But yeah, your primary care provider is an excellent resource because they will know your medical history, they'll know your medications, and they can give you very tailored advice about what things you need to worry about and what things you may not have to worry so much about.
And then if people would prefer not to receive public health alerts this summer, do you have any tips for how they can stay informed while planning their summer activities?
Yeah, I think it's very important to be in tune to who you're having your activities with. Especially here in Colorado, a lot of us have family coming from out of state, and it's important to kind of just be aware what their health situation is, what altitude they're used to exercising at, what their activity tolerance is like. And you can start to tailor your activities to be sensitive to those things, realizing that they may not be able to do some simple things that you take for granted. I do also think that for other folks, a few just basic information pieces can be really handy. Most weather apps now will give you the air quality as well, always paying attention to what the current conditions are. There can be a tendency to have an anticipation of an activity that you've been long planning, maybe even taken time off of work. And so there's this momentum or inertia to do the activity, but it's very important to pay attention to the real-time updates of what's going on. If you're planning on doing a vigorous outdoor activity and you have not been exercising in the heat and you see that it's going to be over 100 degrees, you really have to change your plan or you could really have a bad day. Be aware of what the real-time temperature forecasting is and make sure that you've thought through carefully, are you in the kind of condition that can tolerate that sort of heat?
Dr. Mayer, thank you so much for joining us.
Always glad to be here.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.